I'm Charles Stewart, the chairman of the Arkansas Black Hall of Fame, and it is my privilege to welcome you to our Distinguished Laureate Lecture Series for 2026. This is the 15th in a series of lectures and concerts where we bring back members, those individuals who've been inducted into the Arkansas Black Hall of Fame, to do their thing, whatever their thing happens to be. We've had, as I said, in the years that we've had this, we've featured people like Pharoah Sanders in a jazz concert, Amina Claudine Myers, Dr. James Hildreth, who is now the president of Meharry Medical College, but who did a lecture on HIV, AIDS, Are We Winning the War? And so we've had a remarkable series of different programs, and we are so pleased to bring these individuals back. Usually the night of the Black Hall of Fame induction, there's so much going on that we don't really get to experience our honorees up close and personal. And so this gives us this opportunity. And if you have been reading the newspaper, if you've been paying attention legislatively for the last few years, for many years, but I think it's come to the attention of many leaders and people in the public, the issue of minority maternal mortality or maternal mortality, period, in the state of Arkansas and in much of our country and around the world. You know, you would think that in 2026, the 21st century, that those would be issues that will have been addressed, but for whatever reason, and the rate, the numbers literally are horrendous. And this is a topic that is current. This is a topic that is in the papers. There's something about this subject in the papers almost on a daily basis. And so we thought that it would be appropriate to bring back to the state of Arkansas a person who has taken the lead in the issue of maternal mortality for many years, and the work that she has done in our theme. And we came up with the theme, How the Birthing Project Changed the World. And it literally has, in fact, changed the world. And so we are very fortunate to have Dr. Catherine Hall Trujillo to come back to be with us tonight. She will be more formally introduced to you in just a moment. But as you know, the Black Hall of Fame, we are in our 34th year. And we have, and as I said, this is the 15th in this series. And if we cannot find a subject that is current and that is relevant, then we're not obliged to have the speaker series. But because this is so critical and so important and we are able to address it, we're just so pleased to be able to present this lecture to you this evening. So before we do that, let me again thank each of you for being here tonight. There's so much going on in the month of February, Black History Month. Even tonight, there are projects and programs going on all over the city, all over the state, and I would imagine all over the nation. But you chose to make us one of your critical choices, and for that we are greatly appreciative. So in order to, let's move forward into the reason that we're here. I would like to present and welcome the person who will be doing our formal introduction of our speaker today, Dr. Zenobia Harris, and Dr. Harris is Health Policy Chair of the Little Rock Black Nurses Association of Arkansas and Executive Director of the Arkansas Birthing Project, and in her own right is one of the foremost authorities dealing with this issue. So we're very fortunate to have her, and so we're very pleased, and would you welcome her to the podium for this introduction.
Needs no introduction, actually. She introduces herself, Mama Cat, as I like to call her. 26 years ago now, I met Mama Cat at the Watershed in East Little Rock. She came to present to the March of Dimes, talking about infant mortality, and I was mesmerized by the work that she'd done. And when I found out she was from Arkansas, that sealed the deal for me, and I've been hooked ever since, working with the Birthing Project and advocating on behalf of mothers and babies to hopefully improve the birth outcomes that we experience in our state. Tonight, we're really blessed to have several of our Birthing Project sisters here. Y'all raise your hands to hear Mama Cat. But in addition to all the things that are listed about her in the program, she was recently awarded the Global Award for Public Health Leadership by the Pan-African Global Conference in Ghana. She is an ambassador for the Federation of International Gender and Human Rights, and we're very fortunate to have her as a sister, as a friend, as an advocate, as a mentor, and as a woman from Arkansas. Please join me in welcoming Catherine Hall Trujillo.
As well as the Administrator of Public Health of the Federation of International Gender and Human Rights, shortened FIRE. It goes to the USA, to Dr. Catherine Hall Trujillo, Public Global Award for Public Health Leadership. Mr. President and gentlemen,
well, that only happened over the weekend. And I was not able to go to Ghana to receive that award because for the 3 weeks before last weekend, I was working in Havana, Cuba. And for those of you who are keeping up with the news, you know that it's a good thing I'm from Moscow, Arkansas. And I'm old. So I know what it's like before electricity, because blackouts happen in Cuba unexpectedly. It might last for 15 days, which means not only can you not cook, can the refrigerator not work, surgeries are done by cell phone light, internet doesn't work. So there was nothing I could do in Havana that would allow me to leave Havana and get to Ghana to accept that award. And I felt that, you know how God always has a plan, that for me, tonight was the opportunity to accept the award and to say thank you to my family, who I see my family here, my friends here, my community, the people who loved me, raised me, and gave me roots and wings. But not only that, most of the time when people see me, they think of the Birthing Project. But I don't do the Birthing Project. The Birthing Project is done by communities. I think we're in it's been replicated about 113 times in about 15 countries, and we stopped counting after 17,000 babies. But the heart of the Birthing Project resides here in Arkansas. A lot of people thought they wanted to do a Birthing Project, and they did a version of the Birthing Project. But when Dr. Zenobia decided to do a Birthing Project, that Birthing Project, 26 years later, is still in existence. And she has done every variation of the Birthing Project that you could think of, including one that I was afraid to go to in a sundowner town because, because just the history and the whatever. It's like, now how did that get to be a birthing project? But the thing is, Arkansas was the essence, was the thing that we could not describe in words. That is the heart of what helps a baby get here safely, to know that it is cared for, that it is welcome, that it is prayed over, and that we have high expectations for our babies. And so I get to accept the award now here in Arkansas with my own people, because I know that you know what goes into trying to do the things that take care of each other, sometimes in spite of the sophisticated systems that we build to do things. So thank you for this evening. Just thank you for being here. So I'm going to tell you a little bit about the birthing project. I kind of mingled with you a little bit before we started to see what you knew about the project. But in the center, that is our profile picture of who we are. And that was one of the projects that was started in Arkansas, and I call it the Church Ladies. The big bosom church ladies that say, come here, let me take care of you. And that is what I have found working all over, actually now working all over the world, is that basic thing that makes us who we are in the can-do state, and that we've survived and we still here, that exists every place. But oftentimes the people who hold that energy are not invited into the process of solving the problems that need to be solved. So the Birthing Project was started almost 40 years ago. And almost 40 years ago, I was a big picture fiscal administrator for the state of California. Which I think that if you want to do big picture fiscal administration, you should put, or at least involve Black women, because we know what to do with a little bit of money. And one of the problems that we have, and even Arkansas says they have that problem now, is we don't have enough money to take care of sick people. And I was on a think tank that was supposed to figure out what we were going to do with all these babies that were being born. And at that time, we were having an epidemic where mothers who were pregnant were using drugs. So we were having a lot of babies that were born with drugs on board. And my assignment was to figure out what we could do to save the state of California money taking care of these babies. Because at first when they're born, they're sick and they need a lot of medical attention to keep them alive. And then the second part of that is the courts get involved and social services gets involved. And that average child ends up then in the system. And then you start playing a game where a woman could have as many babies as you could take away from her if you don't figure out what the problem is so that we can stop it at the source where it's happening. And then the really sad part is that most of those kids who are taken and put into foster care end up later being wards of the court and starting their lives all over again. And so my assignment was to figure out what we could do to help reduce the cost of California for all those babies. And as it turned out, I actually did one of those things where when you just kind of get mad with somebody, because when I was trying to do the research for it, what would be a good solution to this problem in California, the people at the Center for Disease Control told me that Black people just had inferior genes, and that's why our babies were dying, was because we just weren't well enough to have healthy babies. And that the reason we didn't have healthy babies was because, and weren't well enough, was because we didn't have a family structure. And so, the fact that we have a family structure with the way we got here in the first place said to me, well, we're not weak, we're strong. And the thing that you're looking at as the weakness is really the thing that is our strength. Our ability to make a way out of no way. Our ability to make family, if it's just play family. It doesn't matter who your blood relatives are all the time. It was like the people who adopt you and call you theirs. And so the idea to me is that, well, all of us are not using drugs. All of us are not uneducated and all of these things that you're identifying us with. We have a history of helping each other. And so the idea was so simple. The church ladies and the ladies that are not church ladies had a tradition of calling each other sister friend or my play sister. And so the whole simple process behind it is just to ask one woman, will you be a sister to another pregnant woman? And just do what a sister would do. And it doesn't even take a lot of training for that. We've been doing that for each other and to each other for forever. Because one of the peculiar things about the slave trade is they on purpose we spoke lots of languages, lots of dialects. Like in San Francisco, there are 325 dialects that Chinese people speak. So when you think about all the dialects that existed where we started off in Africa, we were on purpose put with people that did not speak our dialect so that we could not plan how to get away. But we managed to figure out how to communicate with each other and how to make something called family. So it didn't even matter what we had in common, but it mattered that one woman would say to another woman, you're pregnant, and would you like me to be your big sister while you go through your pregnancy? I'll be there with you when your baby is born, and I'll be like your baby's godmother. So the Birthing Project is almost 40 years old. When I stepped into what was to the baby shower last year at the Birthing Project here, there were 3 generations. There was the little sister who was pregnant, who a sister had helped her. She went through her pregnancy, went back to school, got on her feet, and then she sistered the next person. And we were just passing it on. That is the Birthing Project. It's about that simple. And so the idea was I modeled that project for the state of California by asking 10 women if they would be sister friends to 10 other pregnant women across the board. It didn't matter what your circumstances were. If you were pregnant, then you could have a sister friend. And the woman that I matched myself up with, her baby died. And that was the first time that I actually thought about what it means when your baby dies. And watching a baby being born, and then knowing that that baby was going to die, and being in a very sophisticated hospital where everything was there that could save that baby's life. In fact, she was on a respirator. And before she was, at a certain point, if you're on a respirator, they have to decide if you could stay on a respirator. And so in order for you to stay on the respirator, you have to demonstrate that you have everything to support all the money that's being put into your care. And they told me ahead of time that this baby was going to be taken off because the mother's circumstances. And I just kept thinking about the little girl that stayed on there for years and years and years, but that was not my baby. But when the baby died before they went to court. And when the baby died, that was the first time that I had to talk to my little sister and show her how to hold her dead baby and say goodbye to her baby. And it was when I held that dead baby that I realized when we're talking about infant mortality, we're talking about counting dead babies. And it's a federal pamphlet that described infant mortality in our country, it said that at the rate that we're losing babies, by the end of the century, which would have been 1999, we would have lost more babies in our country than all the soldiers that we had lost in World War I, World War II, Korea, and Vietnam. And that the bulk of those babies were Black babies. And that was the moment that all this stuff and all the data came to be something real inside of me. So my baby did make it, but same with DeAndre. DeAndre came and lived 9 days. It was the 10th day when they were going to take him off the respirator, that he came and lived long enough to change my whole life. Because at that point, as I handed that baby to his mother, I realized that what she needed more than anything at that moment was a woman to be with her through the good, the bad, the beautiful, and the ugly. And that's what we have always been able to give each other. That was the beginning of the Birthing Project. That's how it started. By the end of that year, I had walked off my job. And you know, when you've been poor and you've been on welfare, and for some of you know this because you know my story, there was this time when I lived in the bus station in Oakland with 2 children. You know, and that's the part that people don't talk about when they do your bio. And they talk about your degrees and they talk about your whatever. But there was a point when I was that woman. And it wasn't because I didn't have good home training. Lord knows. My Auntie Carolyn is sitting over there. And her mother, who was my grandmother, was the one that said to me when I had that first child and that bad relationship and ended up in the bus station, she said, maybe this baby will make you do for yourself, but you didn't have sense enough to do before the baby came. You know, so that part of me that was that woman that needed support had an opportunity to merge with that woman who now had that degree and had that position and had some power and could say, this is what we need. We're not stupid, but we need support. We need encouragement. Sometimes you do fall down and you need someone to say, like my grandmother said, bet you won't do that again. You know, it's a different thing. And I'm saying that to say that what the Birthing Project has demonstrated all over the world now is that you could put so much money into a problem. You could build so many things. You could research it. You could do this, that, and the other. All of that stuff is transactional. If you don't do the human part, where you really touch a person's soul and you really make them feel that their life is worth living, it's empty. It's empty. And so now that I felt maybe 10 years ago that I decided I was going to retire from the Birthing Project. There's so much attention on this issue now. There is so much money being spent on this issue now. You don't really need me to be doing the things that we know what to do. So I'm going to quickly tell you what the Birthing Project. So they're in the center. And then the first thing that we did was we built the clinic, which was the first clinic in the country that was a comprehensive maternal and child health clinic and community center that they tell me I was the only Black woman in the United States that was director of anything like that did not report to a white woman. We were the first African American maternal and child health project in the United States at the community-based level that was funded in the country. And that was our clinic, that we got to run it the way that we thought healthcare should be provided to the people in our community. And then something happened. Someone asked us if we would help them start a project in another place and another place and another place. We were in the United States. And then somehow, I know, going to skip around a little bit. The people up here that are graduating with the white jackets, that is the Cuba USA medical scholarship program that was sponsored by the Congressional Black Caucus. And so 25 years ago, they gave 500 scholarships to the United States because to go to medical school so they could come back and work with poor people in the United States because we needed more doctors here. But Clinton did not let them come because he said it would embarrass the United States if we got doctors from another country because it would look like we needed doctors. And so at that point, Cuba said, well, what if we just let 500 of your young people come to Cuba, go to medical school here, have no debt, and then be able to come back and work with poor people. And so our clinic didn't have a doctor because we couldn't afford to hire a doctor. We're all midwives. And so when I found out that they were doing that, I was there when the students got there because I thought maybe we can get a doctor, which we do have one now. And so when we were there, we began to meet young people from all over the world. There are 113 countries who are represented in the medical school in Cuba. And that's when I met the Garifuna. How many of you know who the Garifuna people are? Aha, there's one. In Belize, that's right. The Garifuna people, I thought they were mythological. I didn't know they really existed until I met them. They were the people who were brought here, but they were never enslaved. You know how they say black people cannot swim because our bones are too heavy? They were on a Spanish ship that was coming to this part of the world. The ship crashed in a storm. The Spanish couldn't swim and the Africans could. And it's okay to laugh. And so those are the Garifuna. And they stayed to themselves. They're called the Forgotten People. And they had a contingent of students at the medical school. So somehow they talked me into going with them, and the birthing project went with me over to Honduras to build a hospital. And that group of people, that group of midwives up in the corner, are very similar to the women that were in the center. And the Garifuna are considered some of the best midwives on the planet. They know what they're doing. Isn't that wonderful? And so we here went there to help them. And that was our very first time of actually spreading the birthing project model to people with their language. We had to translate 3 times in order to talk to them because they didn't speak English, they didn't speak Spanish, and there was a dialect in every village where people had that was their own. But we managed to talk to each other and get across the values that we were talking about in terms of this is what we bring to maternal and child health. And we ended up from Mississippi to Malawi. And Malawi has one of the highest maternal mortality rates in the world. If you are a woman in Malawi, you know at some point you're going to die from childbirth. Their birthing project had 3 years where no one in 3 villages died. Because in spite of what CDC thought, Black people are not inferior and have bad genes and cannot grow babies and birth them and raise them. So we started pairing up our women in the United States with women in other countries. That's the Malawi country in the end over there. Above that is a maternity house in Cuba, because when I went to Cuba, I did get involved with the medical school. I met my husband, married my husband who is here tonight, and we're like the parents of the medical school students now. But what I realized when I got there, and I didn't know that, Cuba is the country where a Black baby is most likely to be born healthy and live to age 1 on the whole planet. Did y'all know that? Yes, sir. What do you think about that? Well, I'm going to tell you something else. Cuba is a 66% Black country. Most of us who are in this room, our first contact with this part of the world was in the Caribbean. And many of us came through Cuba. Many of us came through Cuba. As a matter of fact, most of us came through Cuba. So Cuba is 66% an Afro-descendant country. And they not only have the best birth outcomes for Black people on the planet, they have the highest literacy rate in the Western Hemisphere, the highest literacy rate in the whole Western Hemisphere, and one of the lowest rates of violence in the world. I am now mission ambassador to Cuba with the UN organization that I'm affiliated with. And so I get to spend a lot of time, I spend half my time in Cuba. So I'm not telling you about something I read, but I will say that there are only 3 countries that people from the United States cannot visit without a license, and Cuba is one of them. And so most of the things that I knew about Cuba was only what someone had told me that it had an opportunity to go. So I was really fascinated as a public health person about what they were doing there, that everything I knew about Black people in this country was turned upside down in terms of what they had accomplished. So for the last 8 years, I have been doing a research collaborative with the Cubans to see why they have such excellent birth outcomes and what is considered one of the best healthcare systems in the country. And so, of course, we have a birthing project there. That has allowed us to be connected all over the world with that simple idea of looking for what's here in Arkansas, in the Arkansas Birthing Project, that is all over the world, that has done the best job of keeping our babies alive. And what the last 10 years have shown us is that throwing money at a problem hasn't solved the problem. Because now I understand the problem is worse than it was 10 years ago when I thought we had everything under control. So maybe when we ask questions and we're talking together, we might find out a little bit more about that. But in terms of the Birthing Project and how it changed the world, is that it demonstrated that when we have the opportunity to get involved in figuring out what we have to do in order to grow healthy babies, we are good at that. And I want people to throw money at it. I want them to invest in all of these things that they're investing in. But I want them to make sure that when they do that, we are involved in identifying the problem and identifying the solutions, and not thinking that someone else can come in and do more for us than we can do for ourselves. We have the resources to do everything that needs to be done, and all the money that's being thrown at this, we should make sure that we get the money that we need this is a profession. It's a career. It's something that's important enough that people should be able to make this something that it's on your heart, it's on your mind, it's in your hands, that you can do this every day if you so choose to do it. The last thing I'm going to tell you about and say quickly is one of the birthing projects that has a lot to do with the award that I'm accepting. A few years ago, a woman came up to me and said, "I'd like to do a birthing project. Would that be okay with you?" And I said, "Sure." And then I never heard from her again, because everyone that does a birthing project, to my knowledge, gets trained by Miss Alice Rogers Johnson. She is the best trainer in the country, and until you get her stamp of approval, you do not have a birthing project. So I never saw this woman again. And about 6 years ago, she called me and said, "Do you remember me?" You know how you say, "Yes, I do," but I didn't. And I was trying to Google her and do everything I could to see, who is this woman? She said, "I want you to see your birthing project." And what she did with the idea of her birthing project is, she is a woman from Guyana, Africa, affiliated with the United Nations, and she made her birthing project the Federation of International Gender and Human Rights. That if you really are going to talk about human rights, and the United States is the only developed country that has not signed the Declaration of Human Rights for healthcare is a right. So that's why we're still bickering over who should get healthcare and how much should it cost. Her birthing project starts on the foundation that the first human right is to be born as healthy as possible to a woman who has chosen to have you and has the resources and support of her community to raise and parent you. And so that is a UN affiliated organization that I am now the mission ambassador to Cuba. I brought my little badge because I love to wear it, because I never saw one before. But to me, all of these are examples of how the birthing project has changed the world, changed the landscape. Whatever you call it and whatever language you call it, it's that thing that we saw here in Arkansas, that when you think about it long enough and hard enough, you know that God just didn't put us here to abandon us. And God can only do for us what God can do through us. And we have demonstrated that we can do this. We just have to give ourselves permission to welcome our babies and look at them in good faith when they're born and said, "Are you the one?" Thank you.
We've heard a little bit about some of the history of the Birthing Project and the work that Mama Cat has done nationally and internationally. But tonight we're going to talk a little bit more about some of the things that affect the mortality rate in people of color and particularly African American women. Mama Cat, when we talk about, so you talk about how the money that's being spent on this issue and how a lot of resources have been placed on the issue, and yet we still aren't having the kind of outcomes that we believe should happen or that we deserve. What do you think are some of the things that are not being addressed when we're creating programs and designing these really sometimes very elaborate, approaches to dealing with or addressing maternal mortality and infant mortality?
I think English is a very hard language to speak. And some of the things that are most important are hard to communicate because we don't have the words to describe them. And so I think that much of the problem, we don't even know how to explain it ourselves. For example, the average Black woman is 10 years, her body is 10 years older than her chronological age. Is that not true? I mean, there's some things that they call facts. So that is actually a fact. So see, Dr. Zenobia already told you she's one of the smartest people I've ever had in my life. And understands the stuff and can translate the languages. But we get wore out, we get tired. If you think that somebody hasn't drilled into you that you have to be better than anybody else in order to get the job and keep the job, all of those things keep our stress level like this. Most people have, flight or fight. And then you have something that scares you to death, and then it's over with, and then you can rest. We don't have enough rest time between the fight and flight. So I would actually know how someone who doesn't know what you're talking about when you say, I'm tired, I'm wore out, I'm cooked, I don't care. if they don't know what you're talking about, I don't know what they write down in the Monday thing. And so having that outside definition of what the problems are, I don't think we know what problems we're trying to solve when we put all this money into, well, what if you had a doctor? Well, if you have a doctor like some of the doctors I have run into in my lifetime, that only made me feel worse. And that's not necessarily a thing by color, because if everybody goes to the same schools and are taught the same way, then they behave the same way, regardless of what their complexion is, or their spiritual beliefs, or whatever. And so I don't think we've got to the heart of the matter of what it's like to be Black in America. I'm gonna make this a little bit longer answer. Because now that I am working globally, I understand that the United States is not the center of anybody's universe but ours. And I feel very sorry for young people in the United States because we don't get an opportunity to participate at an international level because we are offered so many things that distract us here that we don't know what bad shape that we're in, that the world is falling apart. Like when I was in Cuba last week, I had to have a coat on. They had to buy me a coat because of climate change. The weather is supposed to be 80, 90 degrees there. It was down to like 40 degrees. And people were not even prepared. Nobody had a coat. You know, they're walking around with a little dress this long or whatever. You know, it's like, I want some boots, I want a coat, I want a hat, I want some gloves. The weather is climate change. You know, there are so many things that are happening that just don't happen here. They happen to everybody, and there's no way of getting out of it. And so young people all over the world feel like they have to deal with it, but we in the United States are not really dealing with it like that. We don't, because we have just enough comfort, but we don't see how severe things are. We used to be loved by everyone because people thought that we stood for something. And now the biggest fear of traveling is that someone's going to figure out that you're a tourist from the United States and they just hate you know, for what the things that our country stands for. And I don't think it's unpatriotic to say it. I think that in honor of Reverend Jesse Jackson, whose services today, when he said that what we were doing when we stood up for civil rights was making America be who she said that she was. And even though when they wrote the Constitution, they weren't really thinking about us, that's not the point. The point is now we are America. And if we don't make America be who she says she is, then who's going to do that? But if we don't feel that we have we don't know how important we are in order to do that, then we can't even define the solution because we can't define the problem.
Well, let's talk about this. Dive into this whole conversation that we are having, or is really, I think, becoming an issue for many groups, organizations, service providers, communities, about not mentioning the words diversity and equity and inclusion anymore, and how that affects our health.
Well, for one thing, I know it affected everyone's health. You had to go and take that out of everything they've written. That's right. In order to get your federal money. You have to go through every little thing and cross out that made the blood pressure go up. And you know we already have high blood pressure from the other stuff. But did it change the way you felt about the person? No. But did it make you feel alienated from the people who were supposedly in charge? Did it make you feel like you were on the same team as them, or they were on the same team as you?
It created a wider gap between us.
So what is the main cause of suicide? Feeling isolated, feeling abandoned, feeling like you're the only one. And so if you're looking at the bigger picture of, psychologically, what does that do to people who feel like they no longer matter? They're no longer seen, that they're not supposed to tell the truth. But I think about what's happening to the people that have stepped up to try to take care of people. What are they going through? Where is their inspiration? Where is their encouragement? How do you do what you know you want to do and what needs to be done if there's no incentive to do that? In fact, there's a disincentive.
I think we only have about 5 minutes left, and we want to see if there are any questions or comments out here in the audience. Does anyone have any questions? I want to acknowledge Dr. William Greenfield. He has been a great champion of maternal child health in Arkansas. Maternal death reviews and really sharing some really important information about some of the causes. Dr. Greenfield, I hate to put you on the spot, but can you just share a little bit about us in terms of some of the things that you have seen or discovered in your work with the maternal death reviews, the kinds of things that are preventable, that are happening?
So, back in 2020, the legislature was passed a call for Arkansas to form a maternal mortality review committee. And so, a little unsettling to think that up until 2020, no one was really asking those questions. So we drew a meeting that was that Arkansas consistently ranked toward the bottom in the country. And so where the United States is ranked poorly compared to other developed countries, Arkansas is ranked particularly poor compared to other states. And what we found is that over 80% of numbers of about 90% of what we call pregnancy related death, meaning mom is pregnant and something in that pregnancy, some event, somewhere along the way, there was an opportunity for prevention. And with the context of that to what you discussed and shared so eloquently, is that when we start talking about prevention, a lot of folks in the beginning thought that it was where did the doctor mess up, or where did the hospital mess up. And it's not to say that those things don't occur, but the opportunities for prevention start through a continuum of what a community will do, what a system will do, what resources will be allocated, what a hospital or a facility, what a physician, what a patient and family and a support network should do. And so the concept that you discussed is really bridging all of those things and helping the patient navigate through a difficult time. So what we have found is, as I said, upwards of 94% of the pregnancy-related deaths are preventable. There's some opportunity with some reasonable individual along the way, you can prevent it. And when we looked at the causes of that, heart disease, heart failure, hypertension, disorders of pregnancy, excessive bleeding, all of these things occur. And perhaps one of the biggest things that has been at the forefront of a lot of conversations is that when we move into that postpartum period, I've been practicing obstetrics for 25 years now, and the 6-week postpartum visit is really what you really understand. But everyone knows that that year is a full year of things that are going on as you're adjusting to support. And when we look at maternal deaths throughout that first year, a significant number occur well beyond what traditionally has been the postpartum period. So those represent opportunities for us to learn, to know what our charge is.
I am so happy that you're here. And I want to applaud you and every other person who works in this field, in the system that we have in the United States, where we look at pregnancy and we try to do something about pregnancy when a woman gets pregnant. In the United States, that's maybe the only time she's in care, is when she's pregnant. But my main takeaway from Cuba, and the reason that collaboration was sponsored by Congresswoman Barbara Lee, and she left in December, was because the main takeaway from Cuba is that when you are born in Cuba, you are born into your doctor's practice. And every year, that doctor has to do an assessment and determine a quick category of health you're in, whether you're in perfect health, whether there is something you have that if they do an intervention right this moment, it won't go any further, whether you have something that you're gonna have for the rest of your life, or whether you were just born with something that's not gonna go away. And the idea is that of trying to make this like one thing, you know, it's like one component that we're dealing with, and not dealing with your health before you got pregnant, and that time when you're not pregnant, just makes it harder for you trying to do the work that you're talking about. And then the most important things that affect pregnancy are not what happens when you're pregnant, but what happened before you got pregnant. And those things usually have something to do with the social determinants of health. You know, do you have a house? Do you have food? Do you feel safe? How much domestic violence is there? And you as a doctor, you have no control over that. But until we start like looking at the big picture of what health means, then we're not gonna make a lot of progress. And so I wanna see that happen so that you can have the support that you need to go in there and take care of the medical part of pregnancy. So thank you for doing that, because I know that's a tough job.
And until we have more investments in communities, period, where people do have a place to live, a safe place to live,
Exactly.
and do have adequate food, and don't have to worry about whether they, you know, should look behind their backs or, you know, watch their back all the time. All of those kinds of things really add up. Make sure you have a place, a job, way to earn a living wage. Make sure you have a school that you can go to, that your children can go to and get a decent education. And that you don't have to worry about the level of education you're getting because it's equitable. Everybody's getting a good education. Until we get to that point in our society, we're not going to solve these retractable problems that continue to exist in our society.
That's what we're having a community meeting tonight, and not a closed meeting of healthcare professionals. It's like we're supporting all of that, that everyone here has something that you know that you can do because you are a part of the solution. Yeah, y'all got each other.
So let's give Ms. Catherine a big round of applause.
Let's give Dr. Zenobia Harris a round of applause. Dr. Trujillo, if you would come this way, or I can come to you. As I said, we've inducted about 180 people into the Black Hall of Fame over the 33-year period, and but we've only had 15 special guests who've come back to share their special talents with us, and it makes a difference, and we are so proud to be able to claim you from Moscow, Arkansas to the whole world. And so I'm very pleased to be able to present this as just a reminder of the time that you came to share with us. And better get my glasses now. But it says Distinguished Laureate Series 15 in appreciation to Dr. Catherine Hall Trujillo, February the 26th, 2026. And we're so proud to present this, just to remind you, and hope that you'll put it in a special place among all of those other things that you have right next to your Hall of Fame trophy, perhaps. So thank you. Thank you.
Thank you. That anything I get from Arkansas takes a priority. Any place that anything is shown.
Thank you. We will have a reception afterwards where you can have a little up close and personal time with Dr. Trujillo, but the number of people that I wanted to thank and the number of organizations who have worked with us, the Arkansas Minority Health Commission and Kenya Eddings and AMDPA has helped to support this in communicating, the Black Nurses Association, Arkansas Birthing Project, and Dr. Sam Greenfield at UAMS. And so thanks to each of you for the part that you played in supporting this effort. Also like to thank the board of the Arkansas Black Hall of Fame. These, I think there are about 17, 19 of us now. And these people work, I say, as hard for us for free as they do in many cases in their occupations. And they are the ones that make this possible for us to be able to support public programs like this. And our grant program, which we are in the middle of our grant cycle, where we are able to give out grants to nonprofit organizations throughout the state of Arkansas who are working to improve education, health and wellness, youth development, strengthening families, and economic development in Black and other underserved populations throughout the state of Arkansas. We're proud to say that our grants have impacted 71 of Arkansas's 75 counties to date.